What is the prostate gland? What is the best way to look after it? And how often should it be checked? These are just some of the questions that will be answered during our discussion with Rotarian Neil Owen and Doctors Christopher Gomez and Daniel Caruso, urologists, brought to the Federation to spearhead prostate screening organized by the Rotary Club of St. Kitts. Good morning, gentlemen, and welcome to Good Morning, SKN.
Good morning. Thanks for having us.
You're welcome. It's indeed our pleasure. So we'll dive right into it. What is the prostate and where can it be found on the body?
So the prostate's a gland that all men are born with, and it grows throughout our life. It's situated between the urethra and the bladder, so it's in the pelvic area that's there. You can't see it from the outside of the body. It's really difficult to evaluate because it's so inside the body. And it's there to secrete some fluids that are involved with sexual function. That's there. So it causes some problems for us in the future because it does grow, with age, and it's one of the only glands in our body that grows. So it's unique in that aspect.
Why does it grow though? What's the...
we don't know why it grows, but because it's part of the urinary system, when it does grow, it does create some problems for some men in the future, making urination difficult.
All right, so that is one of the things, obviously, that's problematic about it. I know that when we think about the prostate, we generally think in terms of cancer. So you mentioned, obviously, that's not the only thing that we need to be concerned about, but how concerned should we be of cancer when we get to a certain age?
It's a big concern. Prostate cancer is one of the most common cancers, and especially on the island, black men of African descent and Caribbean descent are at higher risk. And then as we get older, the chance of cancer increases. So we start screening at the age of 40 because that's when we start seeing significant increases in the risk of cancer. So we're asking that all men age 40 and above start the screening process with us.
So you speak to screening. What types of screening are available?
So the two mainstays of screening are a physical examination, I'll talk about that more in a moment, and a simple blood test. And this is something that should be done on an annual basis. It's nice when it's done consistently, like in the case of the screening that's promoted by the Rotary Club. Pre-COVID, we had a nice cadence going where every year we were doing the same screening around the same time of year. And we were seeing men turn up recognizing the fact that they were appreciating the consistency and we can tell them over time, hey, everything's looking good and stable. The physical exam is a relatively quick, painless exam. It definitely invokes a bit of anxiety for the first-timers. I'm here to tell you officially it's something that we recognize there's a level of sensitivity, so we approach it accordingly. We're there to make it as quick and easy as possible. We are literally talking, if you count down from 10, we'll be done before you hit 1. And the other very gratifying aspect of the exam is we will tell you right then and there that all is good. If we feel a normal feeling prostate, and we're essentially, patients ask me all the time, what should normal feel like? If you make a fist, and you feel the smooth part of the muscle between your first finger and the thumb, it should feel nice and smooth. We're looking to feel something that doesn't feel like a bone. If it feels hard and bone-like, we're concerned. Does that mean you have cancer? Not necessarily. There are processes related to, for example, benign inflammation or infection that can create similar types of feels. What it will do, though, is it'll set you up for further evaluation with a qualified urologist like Dr. Thwaites, who might take a little bit further with diagnostic evaluations, and in some cases, a relatively simple, straightforward biopsy process. The blood test similarly comes back within a range of normal. If the level's a bit higher, it starts a discussion about the indication and appropriateness of doing something further. So it's truly a screening process. It's not a true rule in or rule out, you have a diagnosis or don't process. It just kind of puts things in perspective. Am I at higher risk where I need further testing or not? And it's important to underscore the consistency by which you come every year. That puts you in a much more safe position to be told you're in a very low risk group. Because the one thing that's really important about prostate cancer that everyone needs to hear, when people hear the word cancer, whether it's pancreatic, skin, prostate, lung, a lot of folks, especially those who are not in the medical field, immediately think death sentence. They immediately think, I'm going down very quickly. And the reality is with the prostate, that is the exception to the rule. The overwhelming minority of men who are diagnosed with prostate cancer are in a dire situation. In fact, most of them, it's a very hopeful situation. We found something, or we found the risk of something. If it indeed leads to a diagnosis, I would say easily 9 times out of 10, the patient's going to be told, you're in a position where if you consider treatment, and not necessarily treatment tomorrow, take your time, think through the options. Here are the resources. Perhaps within the next 6, 12 weeks, in some cases even 3 to 6 months, initiate a treatment plan with a high expectation for cure. And that's the real benefit of coming to these types of free screenings, is to be given that kind of information so that if, God forbid, you are at risk and you are carrying this diagnosis of cancer, you can be in a position where you get the appropriate treatment and you live on the rest of your natural life.
Yeah.
All right, that's good to know indeed. Are there any other risk factors for prostate cancer? You mentioned obviously the race being part of it.
It's genetic. There's some genetic factors that are there that we don't have that testing available for. Family history is a big risk factor. So if you had a brother, an uncle, a father with prostate cancer, you may be at risk. And there's some evidence that if you have different types of cancer within your family, such as breast cancer, that some of those genes may be contributing to prostate cancer as well. So I would say the other biggest risk factor is going to be family history.
Okay, great. All right, Neil, what turnout are you expecting at this event?
Here representing Rotary Club of St. Kitts, and we coordinate this event every year. We actually started in 2014, and the first year we had 127 males came out. The last year we were able to have it in 2019, we had 420 males come out. So obviously because of COVID, 2020, 2021, we couldn't have the event, but we're really hoping that we can exceed, what we did in 2019. We're hoping we can hit to 600, 650 this year, because, the guys got to take care of themselves. They got to come and see what's going on. They got to find out their numbers. And they got to think about their families. They want to be around for a long time to see their kids grow, to be a partner to their spouse and so on. So we're hoping that we exceed 2019 numbers.
So Neil, will counseling be part of this screening that is being offered by your club?
No. Well, we take medical history.
Okay.
We take the blood draw. We partner with Avalon Labs. They provide the lab techs and the equipment. They come and do the blood draw. And then we do the digital rectal exam. Counseling, I guess, that will come perhaps if you go to the next stage, if you have to see the doctor for more examination, that will be something that happens later on. That's outside of our scope for this project. The event is this Saturday. We start at 7 a.m. We go to 2 p.m. The way we have it set up, the first thing when you come in, you go to the registration area. You need to bring some kind of national ID, because obviously once we get the results at the end, we need to get in contact with you. How do we contact you to tell you your results? You're fine, your blood is this, your PSA is that, or whatever. So you need to walk with some kind of national ID. That's very important. And of course, we're going to obey all of the COVID protocols. So first thing is registration desk, where we take your information, your address, your name, your age, this kind of stuff. Then you move on to the next area, which is the medical history. And we partner with Windsor University, so they provide medical students. It's actually part of their training, so we get them a certificate at the end from the doctors, signed by the doctors. So we take your medical history. Do you have a history of cancer in your family? What kind of history? Other medical issues, hypertension or whatever. So we record that. The next station you go to is the blood draw. And for me, I have a needle phobia. So this one, even saying the word blood draw gives me a little bit of a shake. But we partner with Avalon Labs. We take the blood. So this is so they can do the PSA test. And then the last station, they go to the waiting area where they wait to see the doctors, where they go in to do the digital rectal exam. And this year, because we're expecting higher turnout, we actually have 5 doctors now. Okay. Sometimes we would have 2, sometimes 3. This year, we're actually going to have 5 doctors. So we have Dr. Gomez, Dr. Caruso, we have Dr. Dwayne Thwaites. We partner with him to pull off this project, Island Medical Specialist. And we have Dr. Archibald and Dr. Lawrence, 2 local doctors as well.
Nice.
So usually 30 to 50 minutes from the start to the finish, in and out. So we start at 7 a.m. because obviously Saturdays, the guys, they're busy. Yes. We got daddy duties, we got work, we got errands, we got fix this and that around the house. So we start early so the guys that know that they have to get their day going, they can come early, in and out and go on about their day. And then we go, usually we find around midday, 1 o'clock, the crowd starts to die down, and we wrap up by 2 o'clock.
So Neil, with that said, how soon are the results returned to the gentlemen that attend?
Okay, so the blood work is actually ready by the Monday, but because it's a project where we have to analyze the medical history, the digital rectal, the blood test, we got to put it all together.
Okay.
It takes about 2 to 3 weeks to get everything finished and wrapped up and ready, and that's when we start sending out letters or emails to say, you know, here your total exam was fine, no need to panic, you can come back next year for regular screening, or we saw something that we need to examine, well, the doctors like to examine a little bit further, and then, you know, that's where Rotary's involvement ends, and then it becomes a medical case where the doctor will have a closer look and decide what needs to happen next.
Oh, okay. Good stuff.
All right, so in addition to what you've said before, doctors, is there anything that we can look for as men to say that, you know, there's something wrong with our prostates, as in signs that there might be something wrong?
In terms of prostate cancer, there's not a lot of signs that are there. That's why the screening is so important, is that we want to catch it before there's actually any signs there, because as Dr. Caruso said, prostate cancer, if you catch it early with screening, it's curable. Okay. There are other problems with the prostate that are not cancer related, that are enlarged prostates, which may cause frequent urination, difficulty with urination, pain, infection, inflammation that's there. But that's typically a benign process that is just from the prostate getting bigger and not necessarily with cancer. The problem with prostate cancer is it typically doesn't have a lot of symptoms, so that just emphasizes the importance of getting out there and getting screened.
Absolutely.
Dr. Caruso, is there a follow-up if the diagnosis is negative?
Yeah, there is. So there's a clinical team that will look at these data points afterwards. So if we find something on exam, we'll bring it to the attention of the individual that you can expect to hear follow-up pertaining to this particular finding. Okay. That triggers the nursing staff after the fact to counsel the patient and tell them about the resources available to go to the next step, which should be seeing a urologist for further counseling regarding additional options such as a biopsy. So yes, there is a follow-up process.
Oh, wow.
All right, generally, is there anything that men can do to maintain good prostate health?
As a general rule, this is what I tell my patients back home in the US, a heart healthy existence is also going to be a prostate healthy existence. There's some epidemiologic data out there that suggests that diets that are high in animal protein, red meats, which we know increases the risk for colon cancer, might increase the risk for prostate cancer. And it makes sense. Anything that's processed, generally the things that you know are not so healthy for you, and I'm not talking about like the occasional holiday or celebration. I'm talking about on a routine basis. So a heart-healthy diet, something, lots of vegetables, lean protein, as a general rule is going to be a bit more friendly as it relates to the prostate. It won't necessarily overcome some of these other factors. In other words, and we see it back home, if you have a family where there was a father and the grandfather and the uncles, high prevalence of prostate cancer, therefore a genetic predisposition, you can eat all the vegetables you want. It's not going to change your genome, which once again underscores the importance of, I mean, you can be a particularly fit, highly nutritious individual. Don't walk away from what I'm saying, well, I don't have to go to the screening because this doesn't pertain to me. You can't change your genetics. So with that being said, you get the screening. But you can always help control, I mean, the environmental factors, the diet, the exercise, always a good thing. I mean, in the US, heart disease is a huge killer. I don't know how it is here in St. Kitts, Nevis. So we're always counseling people about cardiac prevention and reducing risk factors. As a general rule, you see a spillover in those folks who take care of themselves tend to have less of a prevalence of certain cancers. Smoking. Smoking is a huge risk factor, tobacco smoking, for a number of different cancers. Do we know with the prostate? Not so much, but we know other urinary tract cancers have a huge association with smoking. So we always counsel people on smoking cessation. And when I say smoking, I'm specifically talking about like a nicotine tobacco, like a Marlboro or some sort of a processed tobacco product.
Great, thank you.
So Neil, can you remind the gentlemen that are watching, and for the ladies that are watching that can tell the gentlemen, where and when is the screening going to take place once more?
Yes, and I got to big up the sponsors too. So this Saturday, so today is Friday, right? So tomorrow, Saturday, from 7 a.m. at Lodge Mount Olive in Taylors. We go from 7 a.m. to 2 p.m. So Taylors is just up the road from Victoria Road. It's right next to SKN Olympic House. So I'm sure everyone knows Taylors, the Lodge building on Taylors. And we're going to have tons of flyers. There's going to be tons of cars there. You can't miss it. So this Saturday, tomorrow, from 7 a.m. to 2 p.m., Lodge Mount Olive in Taylors is a free prostate screening. And of course, I got to say a big thank you to the Masonic Lodge because they allow us to use their building at no cost. We really take over the building for the whole day. All the tents are set up there now and everything. So Lodge Mount Olive is a great partner for us. And one other thing I have to mention, we actually have partnered with Ministry of Education. They're using the school buses to provide a pickup service. So wherever you live in St. Kitts, if you can get to the closest health center to you by 7:30 a.m. tomorrow morning, look out for the Ministry of Education school bus. The school buses, they're going to stop at every health center on the way from, we're starting at, one bus is starting at Sadler's, one bus is starting at Diet Bay, and stopping at all the health centers to bring people into to Taylors. It's not taking you back because you're in Bastille, so you can make your way back, but it's bringing you in. We also are going to have breakfast on sale. We partner with Rotary Club, which is the younger version of Rotary, so we can have local breakfast on sale. There's some fellowship you can have as well. I'm sure you might see some friends or whatever. And we always encourage people as well, if you want to bring someone to give you a little support, that's fine. If you want to bring your wife or your girlfriend or your friend, you can come and they can hold your hand for the blood draw. I know I need that when I get stuck with the needle. I need someone to hold my hand. So yeah, you can bring someone to help you get through it, And can I make up the sponsors now as well?
You can.
Okay, and I don't want to forget any names. So, Lodge Mount Olive, of course. Thank you so much. Avalon Labs. Farm Care is a long-time partner of ours as well. Farm Care provides the necessary supplies that the doctors need. Bank of Nevis, National Bank, Island Purified Water, Care Brewery, another long-time partner of ours. Coscab, distributors for Coke and Dasani Water. The cable is providing free Wi-Fi. So if you find have a little bit of a wait time waiting to get to the next station, you can log on and look at some cricket scores or something to help you calm down and relax. Ministry of Education providing the school buses. A Time for Us Foundation. I'm not sure if you guys have ever interviewed those guys, but they do some great work in St. Kitts for cancer charity. So they work with breast cancer and other types of cancer. So they came on board with us this year, and we're so grateful for that. Scenic Railway is on board with us as well. KFC and Impel, Fonts Rodney provided all of the cubicles inside, so the patients have their privacy for the digital rectal. So those are the sponsors, and without the sponsors, we can't do this project. So we're so grateful to have them on board with us.